My name is Professor Arif Herekar. I'm basically an adult and child neurologist. Today I would be speaking on essential tremors called ET and Parkinsonian tremors called PT. Let's start with essential tremors. The essential tremor medications that are commonly used to treat tremor include beta-adrenergic blockers such as propranolol and the anti-seizure medications primidone. Now, essential tremor is a common movement disorder, and approximately 50% of my cases have a family history. We know it is an autosomal dominant trait. The incidence of essential tremor increases with age and may manifest at any age. I have seen children with tremors, but in them there is a definite family history, and those with a positive family history have an earlier age. The tremor involves mainly the upper limbs, distally, and is postural or kinetic type. Incidentally, in almost 40% of my cases, there has been accompanying head tremors, very mild in some. The other common parts that are involved are the lower limbs, voice, tongue, face, and the trunk. The tremor amplitude worsens with time, and the patients experience difficulty in writing, eating, holding objects, and doing fine motor tasks, dressing, and of course speaking. We continue to elevate doses and they get better, though they might have a little left. Although I think essential tremor usually does not reduce life expectancy or cause other symptoms, many patients have severe psychosocial disability, of course due to their disability tremor. They often increase with anxiety, stress, and in situations involving interaction with people. Patients with head and voice tremor suffer most as they are embarrassed in a crowd and, of course, then develop an obvious depression. I've always advocated that essential tremor should be differentiated from other types of tremors, especially tremors of Parkinson's disease, tremor associated with hyperthyroidism, and dystonic tremor of head in patients with isolated head tremor. Once a diagnosis is made, the severity of functional and psychosocial disabilities should be assessed by objective scales, which will help to determine the need for pharmacotherapy. Now, coming to the management, patients with essential tremor, there are behavioral techniques and physical therapy. I use medical therapy mostly, also counseling them personally, and if very disabling, as a last resort, refer for surgical treatment. I always explain to the patient about the disease, the long-term outcome, and what the therapies can achieve, telling them that all therapies are essentially symptomatic and will not cure or change the course of the disease. If there is minimal functional disability, the patient needs not take treatment. Often I find that even the tremor is controlled by medical therapy. Stress, as I referred earlier, and anxiety will increase the symptoms. As far as Parkinson's tremors are concerned, they are easily recognized and seen as they are larger tremors. Way easier to diagnose as the speech becomes monotonous, and experience over decades has made it easier for me to diagnose them. The involvement of gait is the major difference, and even before we start to examine the patient, the slowness of bradycardia is so prominent that one doesn't even have to demonstrate cogwheeling. With the advent of the newer drugs, of course, which have especially helped in minimizing freezing episodes and have minimized post-treatment complications, most patients fare amicably. Coming to treatment of Parkinson's disease, levodopa happens to be the most effective medication and is converted into dopamine in the brain. We use carbidopa to reduce side effects. Dopamine agonists are important. They stimulate the brain to produce dopamine. Enzyme inhibitors are playing a very important role in treatment. They slow down the enzyme that break down dopamine in the brain. Amantadine reduces involuntary movements, and anticholinergic drugs reduce tremors and muscle rigidity, but are not always feasible in every patient. Coming to surgery for Parkinson's disease, DBS or deep brain stimulation surgery involves implants devices that stimulate the brain. Of course, you can do a magnetic resonance imaging, MRI guided focused ultrasound therapy, a surgical treatment option. Complementary therapies are always helpful, like exercise, physical therapy, speech therapy, occupational therapy, and of course the diet.